Today I'm presenting an older patient with headaches for the past 3 to 4 weeks. The patient described the pain as a band, vice-like grip sensation around the forehead and skull, usually lasting for hours and occasionally occurring during a long computer project, usually I should say. The patient also reported neck stiffness, rated the pain a 7 or 8 out of 10. And the patient denied weakness, tingling, numbness, chest pain, palpitations, dizziness, shortness of breath, coughing, or wheezing. The vital signs were stable overall, with the blood pressure being 136/84. On exam, the patient was alert, in no acute distress, and cardiac and pulmonary findings were unremarkable. My primary diagnosis was a tension headache. My differentials included migraine headache. I also noted prehypertension as a secondary issue, while also considering the possibility of a tumor or migraine. So the headache was most likely because the pain was in a band-like pattern associated with stress and prolonged computer use and accompanied by neck stiffness. Migraine was less likely because the history did not support classic migraine features. Prehypertension was noted due to the blood pressure, but I would not consider that to be the main cause of the headache. One uncertainty I had was whether or not I'd done enough to on the focus exam to support the benign headache diagnosis afterwards. And one question I bring my preceptor is when additional workup would be needed for a new headache that otherwise may seem consistent with a tension headache, but benign. So my plan was conservative management with Tylenol as needed, while advising the patient not to exceed 4 grams per day and educating on medication overuse headache. I'd also recommend stretching, warm compresses, and reducing strain from prolonged computer work, although many of those, also ergonomics, many of those I did not mention, but it was put in my note. So for the elevated blood pressure, I would counsel them on diet changes, including lower salt intake. I also would instruct the patient to return if the headaches worsen, become more frequent, or change in character, which is something that I didn't do, but I certainly should have gone more into that. So for self-directed learning, I'd review the focused evaluation of new onset headaches in older adults and do a better job of education.